Hi guys, so today I had debulking of my venous malformation in my thigh. So just for reference, venous malformation is a congenital anomaly, mostly congenital, present at birth, but it's benign, so meaning it's harmless, but it's very unsightly because like the blood vessels are crumpled, twisted to each other, and on top of that, like the skin, kind of like varicose veins, but it has more affectation. So venous varicose veins that can easily be removed with, sclerotherapy or vein stripping or ablation. But the venous malformation has bigger affectation because sometimes it can go to the muscle area, which happens to mine. And so, when my team of doctors really won't operate where it extended to the muscle area, so they will just remove the mostly outer part. So yeah, I had debulking today. It's a major surgery and I received general anesthesia. So I want to add also that venous malformation, since the veins are crumpled or twisted against one another, so that's why the treatment is different from varicose veins, because varicose veins, the formation is very clear, whereas venous malformation, it's very irregular. You can't possibly untangle each veins underneath your skin. You can't. But the varicose vein, the formation is so clear. That's why it's easy to treat. With venous malformation, it's very entangled, twisted. Sometimes it can even affect like arteries. That's what, luckily for me, it's just mostly veins, but the downside is it extended to my muscles. That's why like the treatment is mostly managing for symptoms, like the pain and the discomfort, but I couldn't expect that my leg will be like perfect. It wouldn't be like my right leg. So that is something I made peace with since I was a kid. My parents brought me to different hospitals in the Philippines, and they don't treat that. And then here in USA, although they treat it very conservatively. That way, they won't touch my muscles, and my work is involves a lot of walking, standing, involves my feet, so they're just preserve my function as much as possible. So, and I'm thankful to my team. And this is my surgical site, guys. It is wrapped with a strap, and it has a drain in there. So I've got a lot of swelling going on here, bruising, and I have this Jackson Pratt or JP drain because when they operate on layers of skin, then there'll be lots of fluids going on, like fluid, blood, or lymphatic fluid. So this drain will just draw the fluid away from the wound to help me recover faster. So that's the purpose of it. And then I've got a lot of bruising going on here, bruising and swelling. So that's what was done to me today. So these are some of the things that I prepare prior to surgery. That way, when I get discharged, I will be ready. So one of it is stool softener. because, you know, when you are prescribed with pain medicine, the side effects, one of the side effects of pain medicine, especially narcotics, is constipation. So I've got that ready. I've got probiotic, although I'm taking probiotic from time to time, but during surgery, they will give you IV antibiotics. So some of those antibiotics can kill the good bacteria in your tummy. So we need probiotics to, you know, to prevent those unnecessary infections like C. diff. I have a pill cutter, just in case I need to cut some of those pills. I'm very petite, you know, some of these strong pills need to be cut for my, I'm easily reactive with medicines, so some medicines I will have to split in half because I can't tolerate them. And you know, after surgery, and especially if you are having a general anesthesia, your swallowing reflex is not present right away. You don't want to choke, so usually your surgeon will tell you to have fluids first. If you can tolerate fluids, then advance yourself to soft diet. So I have some oatmeal here, some cream of wheat, and packets of sugar for those two, for cream of wheat and oatmeal. And I have the Philippine chicken noodles. So I have this chicken, and I also have beef. And besides this, also I purchased shower chair for me, purple shower chair, of course, shower chair and shower mat. That way, when they will give me a go signal to go shower, then it'll be easy for me. Of course, not with the drain. Usually, they won't let you take a shower with the drain on, so that will be after the drain is removed. So, and yeah, I want to give a huge shout out to my husband. He's been taking care of me ever since I was discharged earlier. He's the best nurse. I'm a nurse, but my husband is, if is the best nurse. He can easily ace that nursing job if he wants to. So he take great care of me. And also shout out to my team of doctors, nurses, and anesthesiologists. They are super nice to me and very attentive to my needs. So these are what I prepared, guys. That way, recovery at home will be easily manageable.